POV, you just landed your first outpatient cardiology clinic job and you are so excited to start. And maybe it's a month before you start, maybe it's 2, but you start to realize that even that is not enough time to get ready. And your excitement starts to slowly turn to fear and dread as you realize that you don't have enough resources to learn what you need to learn in time. And maybe when you're doing your shadow shifts, you start to realize that, I really thought I'd have time to ask questions, but everybody is really busy and they don't have a lot of time to answer my questions. And then you think, well, what can I do to get ready? And you try to set aside time to read books, but unfortunately, there just isn't enough time. Well, there is actually another answer, and it's the whole reason that Erin Lee, NP, and I created this new product called the Cardiology Fundamentals Mentorship. It's a place for you to come and learn the core things that you need to learn to get ready for clinic. You're going to learn about how to work up common chief complaints you're going to see, like shortness of breath. What should you look for on the EKG? You're going to learn about chest pain and how to work it up, how to choose a stress test, red flags to look for, things on the EKG that you can't afford to miss that could burn you. You're going to learn all about heart failure, both HFpEF and HFrEF, how the treatments are different, and what you need to know in order to be a safe provider, including the 4 pillars and a good review of them. You're going to get immersed in high-risk EKGs and arrhythmias so that you will know exactly the patterns to look for when you're out there and under pressure, seeing patients every half hour to make sure you don't miss a thing. You're also going to get a complete overview of ACS, including a cheat sheet on how to pick the right stress test. You will also do a lot of pre-op visits, and we'll be providing you with all the materials you need to succeed. And of course, you're going to need to know how to treat lipids, but we've got you. There's a wonderful lecture called Lipid Limbo, How Low Can the LDL Go, and a great prevention module because Erin Lee specializes in just that. And we're going to finish off with some valvular heart disease and hypertension because these are things that you're going to be dealing with every single day. And of course, the one thing they never prepare you enough for is the peer-to-peer phone call that you're going to have to make to get your test approved. But don't worry, we have you covered there too. We included a handy peer-to-peer tip sheet. This comes with 5 hours of CE and lots of bonuses, including some smart phrase templates that you can actually steal and start implementing to cut your documentation time down in half. There's also a good review on cardiac pharmacology and how to document. And of course, there's some other bonuses like pulmonary hypertension. And also there is a every other week live EKG class you can attend while you're in the course. Now, this is a 6-week program, but you can jump in now, start watching the modules, and then you'll be able to attend the live calls with us, which happen every Wednesday for 6 weeks. I look forward to seeing you in class. This will hopefully take your stress away so that you don't have to search for all the resources anymore.